Every day we are exposed to hundreds of chemicals. Some we've known about for many years, others have recently been created or discovered, and we've developed new ways of measuring their presence for the first time. For some we know their effect on people, and some we don't. In 2007, the Minnesota legislature established the Biomonitoring program for the purpose of tracking people's exposure to a variety of chemicals. This program provides information for programs and policies that might reduce any potential health impact of these chemicals. We're going to talk about the Biomonitoring program on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about the Biomonitoring program within the Minnesota Department of Health. It's a program that tracks exposures to chemicals in vulnerable Minnesota populations, with a particular focus on pregnant women, children, and disadvantaged communities. The goal of the program is to provide data to inform decisions and evaluate actions for protecting future generations from the chemicals within our environment. Joining us in this discussion is Dr. Jessica Nelson, an environmental epidemiologist at the Minnesota Department of Health. Dr. Nelson works on designing, coordinating, analyzing, and communicating about results from the Biomonitoring project. Dr. Nelson, welcome to our program.
Thanks. Good morning.
Let's start with some basic things. We've got environmental tracking and biomonitoring. What are these two different things, and why are they in existence?
Okay, so biomonitoring actually measures levels of the chemicals that you mentioned in your introduction in people. So it tests for chemicals in blood, in urine, in hair. And it's really the best way to find out which chemicals and how much of the chemicals a person has come into contact with. Environmental public health tracking, which is linked with our program at the Minnesota Department of Health, is a larger national effort that's trying to make data on the environment and on health publicly accessible. The way that biomonitoring fits with tracking is that it's really kind of the middle piece that connects what is happening in the environment and like what chemicals might be out there, excuse me, with possible health outcomes.
All right, so we got a little slide here that I think shows three little bubbles that shows, the hazards, the exposures, and health. And so the biomonitoring sort of fits in that.
It's the middle exposure piece, exactly, that connects the dots between the hazards that could be in the environment and possible health outcomes.
Okay. And how long have you been doing the biomonitoring in Minnesota?
So we are actually one of only 2 states that has a biomonitoring program established by state legislation. Our law was passed in 2007, and it was a really innovative law. I think legislators realized that there were a range of Minnesota communities that might be having exposures to chemicals, and they saw biomonitoring as really a key tool to help figure out, what are those exposures, at what levels are they happening. And then a very unique part of our state law was actually to make the connection between environmental public health tracking and biomonitoring. I don't think that hasn't happened in any other states. So they really saw that connection there and established this law in 2007.
All right, and I know I want to have some examples of things that we've been tracking and monitoring. And one I think is lead in gasoline, and let's start with a slide that shows what's going on. So maybe you could explain what's going on in this slide and how this really relates to biomonitoring.
Sure, yeah, it's kind of a great classic example of a very useful function of biomonitoring. So as you can see, the blue line is showing gasoline in lead in gasoline, and as that was decreasing in the late 1970s, what biomonitoring data showed, which is the red line, is that blood lead levels, and this was sort of for the US population, but that those blood lead levels were having a dramatic decline, which was really right in line with the levels of lead in gasoline. And interestingly, they had predicted that blood lead levels wouldn't come down quite as much. That's that gray line. But the biomonitoring data showed, yes, there is this very steep decline right in line with the levels in gasoline. And it really, I think, prompted the EPA to continue that phase out and the restrictions more quickly than they would have. So it's a really good example of biomonitoring, tracking exposures over time, and pointing towards policies that either need to happen or that have happened and been effective at bringing down chemical exposures.
And this is a perfect example, as I talked about the fact that the biomonitoring program focuses on vulnerable populations. Lead was particularly damaging to children, young children, and also populations, low-income populations living along highways. So this data, I suspect, really was influential in actually improving the health of those individuals.
Yeah, I mean, you saw the decline in those blood lead levels. That's definitely a public health.
Right. And we also have another one that I think people may not recognize, the fact that a thing like the smoking restriction laws. And so we have a slide that really shows the cotinine levels in individuals. That's sort of the things from tobacco smoke. Explain what we're seeing in this slide.
So in this slide, you can actually measure a chemical called cotinine in blood, and that is sort of a marker of someone's exposure to tobacco smoke. So this slide is showing in kids who don't smoke the fact that cotinine levels in blood dropped over time. So the first bar is 1988 to 1991, and you can see that by more recent years, by 2009, 2010, after a lot of the smoking restrictions and smoking bans had gone into place, that level in kids had dropped quite steeply. So it's another really good example of this. Looking over time, have measures been effective, which we hope they would be, but it's just sort of a much more direct way to measure it than to ask somebody a question and kind of get their self-reported answer. It's actually a level in the body that shows you what they came into contact with.
So how do you determine which chemicals to measure? I mean, I don't know how many chemicals there are in the world, but we're creating new ones all the time. And, so which ones do you measure and do you monitor?
Yeah, that's a really good question. So our state program, when the law was passed in 2007, it actually directed the Minnesota Department of Health to conduct 4 biomonitoring pilot projects. And it even laid out specific chemicals in many of those cases. And those were chemicals that were of concern in Minnesota communities and that were of particular health concern, I think. Because as you said, for some chemicals we know a lot more about possible health effects and at what levels. For other chemicals we're concerned about them, but the evidence is sort of more on the emerging front. So different programs take different approaches. We've sort of, I think, been a combination of chemicals of particular health concern, especially with developing babies and vulnerable populations in mind, as well as community concerns about exposures in a community. Another example, though, is there is a national biomonitoring program that the CDC runs, and they test for over 200 chemicals every couple years in thousands of Americans' blood and urine. So, there are hundreds of chemicals you can test for, and as a smaller state program, it is sort of a different decision about which are the ones that we're going to be able to include in our programs.
And so do you actually go out and collect blood and urine and hair samples from folks?
Yep, that's how our program has worked. Yeah, we have a number of, we've completed those 4 pilot projects. We've done some follow-up work on them, and they've all involved going out. We've tested Minnesota adults, kids. We've been in urban metro area. We've been in suburban metro area. We've been in non-metro parts of the state.
So what are the 4 areas that you monitor?
Well, so the 4 pilot projects. So the 4 pilot projects that we started with were testing for perfluorochemicals, PFCs, in some East Metro, some communities east of St. Paul that were exposed to these chemicals in drinking water. We've tested arsenic in the urine of kids in South Minneapolis. We've tested for a few different hormone-mimicking chemicals found in personal care products in pregnant women in Minneapolis. And then there was a project that tested for mercury in North Shore newborns. That was actually done by our Fish Consumption Advisory Program.
Good. All right, so we've got some examples and some charts on those, but first, before we get into those, we need to take a little break.
Okay.
We'll be back right after this message.
We are all connected to the world around us. Our actions affect our environment. And in return, our environment affects us. The health of our environment directly affects our health. We need more than exercise and a good diet to take care of ourselves. We need knowledge. But how can we make the connections between our health and the complicated world we live in? The Centers for Disease Control and Prevention's National Environmental Public Health Tracking Network. The environment plays a role in many chronic diseases, but we don't always understand the connection. Now, the CDC lets you see information about some health trends and environmental hazards in your community. Vital public health information is now united with environmental hazard and exposure information in one dynamic website. CDC's National Environmental Public Health Tracking Network. For the first time, you will have an easy-to-use tool that lets you see health and environment information together. We can work together towards a healthier planet and healthier people. CDC's National Environmental Public Health Tracking Network. The future of environmental public health.
Welcome back. We're talking about Minnesota's biomonitoring program with Jessica Nelson from the Minnesota Department of Health. Jessica, there's an interesting video that shows sort of the biomonitoring and its importance and what it does. And prior to our break, you had mentioned there were 4 different areas that you really focused on as sort of pilots. And so I want to go through some of those because I think it gives people an example. And I particularly people in the East Metro area, you said, where there are PFCs.
Yeah.
Whatever those PFCs.
That's an easier, yeah.
Yeah. So let's start with this slide that shows the East Metro towns where PFCs were a concern. So tell us a little bit about what was going on with that project.
Okay, so in 2005, it was discovered that certain towns in the East Metro, and you can see some of them on this slide. So the ones we focused on are Oakdale, Cottage Grove, and Lake Elmo. But it was discovered that those towns actually had public and private drinking water sources contaminated by perfluorochemicals, or PFCs. PFCs are chemicals that are used to make products resist stains, grease, water, things like that. They've been used for a long time in those kind of products. And in these areas, there was legal waste disposal of waste that had PFCs in them, and the PFCs then got into water supplies. So we knew that there was this contamination of the water. In 2006, a public health intervention was put in place to reduce the levels in water. And so then biomonitoring came in. We actually did projects in 2008, 2010, and we're currently doing one right now to find out what the levels were in those communities. We discovered with the 2008 project that PFC levels in blood in longer-term residents from those towns, so people who had actually drunk the contaminated water, so PFC levels in their blood were higher than national averages. They had elevated exposures. What we saw in 2010 when we measured those same people's blood 2 years later,
and I think we have a slide that shows the downward trend. So let's put that slide up while you're talking about what happened.
Yep, so 2008 is shown there in blue, and then 2010 is in gold. So in 2010, we found that the blood levels had actually declined substantially in that 2-year period. And that really told us that all those efforts made to reduce the levels in drinking water worked. They were effective. And now we're going back in 2014 to kind of do a 3rd round of sampling to check that that's still working. And we're actually testing a newer group of people as well, newer residents to the East Metro who didn't drink the water. And we want to be sure their levels are more like sort of US background levels.
So if some community has some concerns, how could they get a biomonitoring project going on?
Well, they can certainly contact us with concerns. It's certainly a process of kind of deciding where the priorities are and where a program could go. A really important part of our program that the law started in 2007 and that we've been able to do is to develop the laboratory capacity to measure these chemicals. So our state, the MDH Public Health Laboratory, can now measure 16 to 18, I'm not quite sure what the total number is, but can measure these chemicals in people's blood and urine, which is a very specialized technology. So for any new chemical, it's kind of a process of, can the lab do the method? Is there a method? And then deciding, kind of where the priorities are.
And I know the program really focuses on vulnerable populations and pregnant women and kids and other areas. So we've got a slide here that talks about mercury in New York City, and it's probably an example of something that happened. Tell us why mercury is an issue and what this slide is telling us about how certain chemicals really disadvantage some populations over others.
Yeah, biomonitoring is a really powerful tool to show if there are disparities in exposure. It shows those very clearly. Mercury, of course, is a concern. It's a metal. The biggest concern really is exposures to the developing baby. It can affect developing brain development in babies. So that's sort of a big focus there. New York City has this biomonitoring program where they sort of routinely do biomonitoring on their population. And what they found, as this graph is showing, was that New York City folks overall actually had higher mercury exposures than U.S. background. So that was of a concern to them. Why is our population, overall having higher exposures? But then they found, as you can see, that the Asian population in New York City had much higher exposures than other populations. So that was sort of a clear case where there was a disparity. And I believe they used this information to tailor some of their public health messaging around fish consumption, because consuming certain types of fish that contain higher levels of mercury is, probably the biggest way that people are exposed to mercury. So they use.
And don't we have a monitoring program in Minnesota related to mercury along the North Shore?
Yes, that was the project done by our Fish Consumption Advisory Program, and they tested some newborn blood samples for mercury just in the Lake Superior region. And
did they find issues related to mercury in those newborns?
They did find that of the babies tested up there, that there clearly were some moms who were having higher exposures to mercury than we feel is safe and then is good. So actually, some of the MIN biomonitoring program's current work is following up on those questions. Are there other communities in Minnesota that have these exposures? Because we really don't have biomonitoring data for other communities in Minnesota. And really importantly, are there disparities in Minnesota's populations like New York City saw? Because we do not know the answer to that question.
All right. One other thing in this segment that I want to talk about is the disparities in pregnant women related to parabens.
Yep.
Tell us about parabens and why that's being monitored in pregnant women.
Okay, so parabens are chemicals that are used in cosmetic products. If you look on the labels of shampoos and lotions, you often will see parabens. They're one of these chemicals that are sort of more in the emerging evidence category. We're concerned that they might sort of be hormone mimickers, but it's not quite as clear, like with mercury, sort of what a harmful level might be, for instance. But we're concerned about them. So one of our pilot projects looked at paraben levels along with bisphenol A, the chemical found in plastics. So we looked at urine levels of those in a smaller group of pregnant women in the Twin Cities. And as this,
we've got the slide. We'll put the slide up that shows what's going on with those.
As the graph shows, we saw really striking disparities by race and ethnicity. So we saw that non-white women had paraben, especially this one type of paraben in blue, the methylparaben. So non-white women had urine levels that were 3.5 times higher than white women. We saw some differences by income as well, but it was really that racial ethnic disparity that was most striking. And actually, national biomonitoring data has seen this as well, a similar difference. So, the question is, why are there these differences? Do these different levels mean that like the babies of these pregnant women may have different health effects? These are kind of the questions that it raises.
So you generate a lot of questions. You said this is what's happening, but you may not know why it's happening, right?
Yep. Yeah, in many cases, biomonitoring can be actually useful to pinpoint sources of exposure, especially when you can ask survey questions along with it. So when we can, that's something we definitely try to do. But it does raise questions.
Good. Well, we have a lot more to
good
talk.
Research does, right?
We have a lot more to talk about. We need to take another little break.
Okay.
We'll be back right after this message.
Don't let E. coli mosh with your food. An estimated 3,000 Americans die from a foodborne illness each year. You can't see these microbes, but they might be there. So always separate raw meat from vegetables. Keep your family safe at foodsafety.gov.
Welcome back. We're talking about Minnesota's biomonitoring program with Jessica Nelson, an environmental epidemiologist at the Minnesota Department of Health. What's an environmental epidemiologist?
Well, two very big words. So epidemiologists really study health and disease in groups of people. So we look at patterns, we look at causes and effects, risk factors, and really importantly, we try to study changes that can improve health. The environmental part of that is sort of looking at exposures in the environment more specifically, because there's
as opposed to infectious disease epidemiology.
Exactly.
All right. So what have you learned in the 7 years of the biomonitoring program?
Yeah.
What has been the impact?
Yeah, that's a great question. So really, the way that this 2007 law was set up was do these pilot projects, gain knowledge and experience, and learn the lessons that can sort of inform what you think the program should look like in the future. And we've definitely sort of come to this larger vision for the future, which we've talked about a little bit, which is to focus on vulnerable Minnesota communities, so pregnant women, children, disadvantaged communities. And what we hope to be able to do in the future is to measure a greater range of chemicals rather than just an isolated few in each group, and to do this systematically and over time so that we can look at some of these time trends. Are things going up? Are they going down? So that's sort of the vision that we have for the future, and a lot of the key lessons that we've learned. But certainly building the laboratory capacity, building our epidemiology capacity to do the studies has been huge.
You have something called minfeet as sort of the new direction you're going in. Tell us a little bit about that.
So minfeet is one of our big current projects. It stands for Minnesota Family Environmental Exposure Tracking, minfeet. And what minfeet will do, it will measure 3 metals, so mercury, lead, and cadmium, in around 600 Minnesota pregnant women and their newborns. We're focusing on these metals because they're really of key concern for this child development, this brain development aspect. And we'll be testing these chemicals in Hmong, Latina, Somali, and white women. So we'll be able to see, are these exposures happening, at what levels, and really importantly, are there disparities in these groups and exposures. So we're kind of finalizing our planning right now for that project. We hope to start enrolling women early in 2015, so stay tuned for that. But one reason minfeet is a really exciting project is because it does kind of move us more towards that the future vision I just mentioned, which is tracking chemicals in these groups. And hopefully, minfeet is a great start, but we certainly would hope to expand to different communities and to find a way to do this over time in the future.
Who uses the information that you generate?
There are a range of stakeholders. Certainly, agency and public health programs that target these chemicals, that work with some of these groups, are key audiences. I mean, we really see ourselves as providing data that's used to inform and evaluate the range of public health interventions that we put into place to try to reduce chemical exposures. So certainly, state agencies, but also advocacy organizations who work directly with communities and want to give communities advice. Local public health does a lot of work in communities with targeting exposure reduction efforts. So there's quite a range of audiences who can use the information.
Do these data get uploaded to the Centers for Disease Control or Food and Drug Administration at any federal?
At this point they don't, and that's actually something that this National Environmental Public Health Tracking Group is thinking about. Is as more and more states get interested in biomonitoring, is there a way to do that? Right now it's sort of more state specific, like what are our exposures of concern and what are the populations that we're including. So right now we do have a website for our state's biomonitoring program that has information, but to my knowledge there's not sort of like a national storehouse, but that would be a great vision in the future to be able to compare different locations. And
so if the general population wanted information, I mean, is there a portal where they can get some of this information if they're concerned about what's going on in their community or things related to pregnant women?
Yeah, well, definitely our Minnesota tracking program, the Environmental Public Health Tracking Program, a big part of their work is maintaining the Minnesota Public Health Data Access Portal. And that is the place where all of this tracking data on environment, exposure, and health. So you can go there and search everything from air and water quality to childhood lead poisoning to asthma, cancer, other health outcomes. That's all there in a publicly accessible way. And then our biomonitoring program, there's some biomonitoring data on that portal. It's more at a national level, but there certainly are links to kind of our state projects when we have them. So I think I would definitely send people to that Minnesota Public Health Data Access Portal.
Right. Well, this is certainly an evolving field and a really important field as we get more and more chemicals that are coming into our environment and recognizing that they have health impacts. So thanks for giving us sort of a little primer on biomonitoring.
Thank you.
Thanks. I'll be back with a closing comment right after this message.
Every budget, so don't accept defeat. Now you can get covered and still buy me treats. Enroll.
The new world of healthcare is here to stay. Do something for those who care about you. Enroll today.
There's an old management saying that says, what gets measured gets done. Measurement plays several different functions. First, measurement underscores the importance of the thing being measured. If you don't measure something, most people think that it's because it's either not important or not a problem. Secondly, measurement allows us to evaluate the direction things are going and how different programs and policies might be affecting the things being measured. And thirdly, measurement allows us to better plan for the future. Knowing where we are helps us to plan for where we want to go. Minnesota's biomonitoring program does all of these things, but it also does one more thing. It allows us to target our efforts to where programs and policies can make the most difference. It helps us set priorities. In particular, it focuses on those population groups who are most vulnerable to the effects of chemicals found in Minnesota and who are least able to modify their environment to avoid those exposures. These groups include newborns and children, women of childbearing age, and disadvantaged communities. These groups are either more sensitive to the effects of chemicals or are exposed to higher levels of chemicals. If we are going to be a healthy state now and in the future, these are the groups who need special attention. Fortunately, the biomonitoring program is doing just that. By measuring exposure to these vulnerable populations, we can better address their risks and their needs. So let's hope that it's true that what gets measured gets done. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.